if you were informed that you need to update your TB test, Seema is going to be conducting TB test after her presentation over here in the corner. So please give her your attention as she presents to you on medication management. Thank you very much.
Thank you, Mary. Thank you. Hi, as you have heard, my name is Seema, and I'm glad to do this presentation. And the presentation is medication use safety for seniors. And why are we here today? After viewing this program, all the adults and their caregivers will be able to discuss the following things: the general risks and benefits of medication therapy, the differences between prescription medication and over-the-counter non-prescription medicines, common medicine use problems, ways to improve medication safety, quality communication with healthcare professionals, which is very important, keeping a medication list, understanding over-counter drugs and facts, and the facts on the labels. What is a medicine? A medicine is a drug changes how your body works. It treats, prevents, or prevents a disease or symptoms. And when correctly used, medicines can lead to a better quality of life, healthier life, and a longer life. Prescription medications, such examples are blood pressure medications, blood thinners, antibiotics, and eye drops. And over-the-counter medications or non-prescription medicines, an example is aspirin, acetaminophen, cough medications. And what's the difference? Prescription medications, by the name, are prescribed by a healthcare provider and can only be taken by the patient when prescribed. While on the other hand, over-the-counter medications are self-prescribed, and it's you who decides, according to your need. I have a pain, and then you go buy a Tylenol. But both of these should be reviewed by your healthcare team. Why? Because they can cause drug interactions. Another group we have are dietary supplements and herbal remedies. And also these are self-prescribed and are available from many sources. But for these, you are responsible for choosing the correct medicine, dose, and watching the side effects. Herbal remedies do not follow the same strict rules that prescription drugs do. For herbal remedies, the manufacturers do not have to prove that the product is safe, effective, or that it contains the ingredients on the label. So medicines have risks. It's important to know that medicines, both prescriptions, over-the-counters, have risks as well as benefits. The risks of medicines are the chances that something unwanted or unexpected could happen when you use them. The risks could be less serious as an upset stomach, or more serious, such as liver failure or kidney failures. Medicines can cause problems even when used correctly. And one of the problems are allergic reaction. When your body defense system reacts in a bad way to a drug and you end up having a rash, you are itching, or you have more serious consequences like narrowing of the throat, difficulty in breathing, and shortness of breath. Versus side effects. These are undesired effects of a medicine. Some side effects that are common are headaches, upset stomachs, and others that can be rare are liver failure. Side effects can occur even though the medication is used correctly and at a normal dose. So if you go to your POC, you will find the different allergies that particular client has so that you're aware of them. And this is very important because you don't want your client to take a medication they're actually allergic to. So that information, you will find it in that patient's POC. What are medicine use problems? Medicine use problems are anything bad that happens to you as a result of taking only one medicine or several medicines. Medicine use problems can result into you not getting the best results from your medicine. And also medicine problems can prevent you from getting well as fast as you would like to. They'll make you sicker and they'll lower your quality of life, cause disabilities, accidents, or even worse, injuries. Potential medicine use problems. One of them is overuse. Taking more than prescribed or recommended, more than prescribed dose recommended by your healthcare provider or the label on that particular medication, and taking unnecessary also medication. Underuse will be taking less prescribed or recommended, or by missing or skipping doses. Not following instructions for use carefully, and drug interactions. We're going to see each of these. So for drug interactions occur when drugs interact with one another, or with food, or with alcohol, and this changes the way the drug acts in the body. These interactions may cause unexpected side effects. The drugs involved can be prescription medication, over-the-counter medications, or even herbal products. So you have to be aware of this. And examples of these interactions are shown below, like warfarin is a blood thinner, and its interaction with antibiotics like levaquin. This can cause, the blood thinner thinning the blood too much, and you get bleeding problems. Another interaction is warfarin interacting with green leafy vegetables, and also will cause the same, cause you to have excessive bleeding. Alcohol, that's a common thing. Whenever all of us, we go to our doctors, we get medication, they say, please don't, take alcohol with this medication. And one of them is like tramadol. And other medications like Zoloft interacts with St. John's wort. St. John's wort is a herbal remedy. So all these interactions we have to be aware of, and also look at, at what our clients are taking, so that we can be able to report this to their healthcare provider. So what can cause a medicine when can medicine use problems happen? So they happen when a new medication is added to the regimen, when a medicine is stopped, when the dose of a medicine is changed. And we spoke about this when alcohol is consumed while taking medication, when over-the-counter and herbal products are taken without the doctor or pharmacist knowing they're part of the regimen. So you need to make your doctor, the healthcare worker, aware that you're taking this over-the-counter medication, or you are taking this herbal remedy, so that they'll be able to prevent this drug interaction that we spoke about previously. And also these problems can just happen anytime. So what is a way to avoid these medicine use problems? We spoke about one of them, and the major one is communication. You're asking questions to increase your knowledge, talking to your health providers, and keeping an updated medicine list. And when you have this medicine list, you let your healthcare provider or the healthcare provider of your client know that the medicines, including herbal remedies, over-the-counter remedies on that list, so that they'll be able to know the interactions and prevent these problems. And also using one pharmacy, and also reviewing the medicine. Check your prescription prior to taking it. Sometimes maybe there's an error that has been done, and you're able to prevent a problem happening to you or even to your patient. So know your medicine. Know what your medicine is used for. Know the brand. Know that if it's a brand or generic. Know where you store it. Certain drugs, they have to be stored in a particular way. Know how much to take, what time of the day to take it, and to take it with food. Some medications, you shouldn't take them with food. So you have to know the instructions given when that medication is given to you at the pharmacy or given to your client. and how to tell. So you should know what to expect. You should know what that medication is going to work, its possible side effects, and what to know and what to do about those side effects. Some of the tests you need to do when you're taking certain medications, especially like blood thinners, some antibiotics, there are tests you need to do to make sure that that drug is effective in the patient's body. And also you should know what to do if you miss a dose. So when visiting your healthcare professional, you need to have your medication list, the types of medications you are taking, even over-the-counter medications, herbal medications, vaccines, and what the medications are used for and how to take those medications. So make a copy of your list, have one list for yourself, for the patient, but even for the relatives, for the loved ones, so that everybody has information and knowledge about the medication the patient is taking. And prior to your visit, make a list of questions. Ask about the disease, the symptoms. Ask about the need to continue current medications, over-the-counter preparation, non-drug treatments. And you also have to ask questions about follow-up appointments for your client, so that their prescriptions will always be filled and they won't be, lacking medication and then getting into further worse consequences of their disease. So as we spoke about over-the-counter medications, they have labels. They'll tell you who is supposed to take that medication, who is not supposed to take it, the ages of those people supposed to take it, and the dose, and how to take that medication, whether with food, without food. So all that is on the label. So it's important always to read our labels. And also on those labels, they'll always give you the active ingredients. They'll give you the directions, and also they'll give you how to store them, the temperatures. It's always there on those labels. Ways to avoid medicine use problems. So the information, usually you are given an information sheet when you get your prescription at the pharmacy. So read it very carefully and follow, and follow the instructions of how to take that medication, and also again how to store it and all that thing and all that. And also on that information, it will also let you know the side effect of that medication and what to watch for, and the warning signs and precautions that you need to take, and also most importantly, the storage of medication. So these are the 3 R's to remember for safe medicine use. You need to remember that all medications, non-prescription and prescription, have risks and benefits, and you need to weigh these risks and benefits carefully for every medicine you take. You need to respect the power of your medicine and the value of medicines properly used. You need to take responsibility to learn how to take your medication safely. Medication is administered by different routes into the body, and the way the medication enters your body is called the route. And the most common route for medications is orally or by mouth in form of pills, capsules, liquids. However, if a person is unable to take orally, there are other forms or routes that they administer the drug. So the first one is the oral route. The second one is sublingual. The third one, that's under the tongue. Then you have nasal, through the nose. If you have an eye problem, it will be administered on your eyes, in your ears. Transdermal is through the skin, and then tropical would be on top of the skin. Subcutaneous would be under the skin. Enteral would be through a tube, say a G tube. Rectal would be, as the name says, through the rectum, and vaginal through the vagina. So there are different routes of administering medication, depending on the medication and depending on the severity of the disease. So these are the do's and the don'ts. So do's, this is what you need to do. You bring your medication from the pharmacy. Again, read the label to the client. Open the bottle and open the proper slot on the pill box, and bring water and supplies for the patient to take their medication, and call the office or call the healthcare worker if you have any questions. But these are the don'ts. Don't decide over-counter medications to buy, because we talked about interactions with drugs. And don't educate and give advice to that, especially medical advice to your client. Leave that to the doctors and the nurses. Do not take out their medication from the pill box with your hands. Kindly use gloves, and do not administer the medication through any route. Follow the prescribed route, if it's oral, rectal, anything like that. And do not assume do not assume and do what the client asks you to do. Follow the instructions on the bottles or on the labels. So skilled nursing services. Skilled nurses come to assist the client with the medications, and these services are covered under CCSP or SOS programs. Typically, the nurse would come weekly to assess the patient's conditions and compliance with medications, to reconcile the client's medication and report any issues to the client's doctors, to pre-fill the current pill box or insulin syringes, to educate the client about medication regimen and answer any questions. In special circumstances, the nurse may come to the client more frequently than once a week. And also, some aides may be allowed to administer medicine to their clients after they have received one-on-one education and are deemed competent by their nurse. So you have to recognize that you are the eyes and the ears for your patient. So look for something that's unusual, something that's not right. Our nurses and therapists rely on you. So call the office with any questions and concerns. And we can always reach a nurse for you in case you have any questions. We have a nurse during the day, and also we have nurses on call after hours. Our clients need you every day so they can stay in their own homes rather than going to nursing homes. And remember Medside's slogan, because home is always better. And remember, you are the most important part of our healthcare system. Thank you very much. I need water. Agua.
So now I'm going to change the next presentation. Okay, the next presentation that Seema is going to go over with you is Alzheimer's disease, behaviors, and intervention.
Sorry about that. I was drinking something real quick. Thank you. So next, we're going to talk about Alzheimer's disease and the behaviors and the interventions you as a caregiver, you can give this patient. Alzheimer's disease and other dementias can cause people to act differently and in unpredictable ways. Some individuals become anxious or aggressive. Others repeat certain questions or gestures. Many misinterpret what they hear, and these types of reaction can lead to a misunderstanding, frustration, tension, particularly between the person with dementia or the caregiver. So it's important to understand that this person is not trying to be difficult, but it's the behavior is their way of communication with you. So the following 3-step approach can help you identify the common dementia-related behavior and their causes. So examine the behavior. What is the behavior? Is it aggressive? Is it frustrated? Was it harmful? Did something trigger it? Are they in an unfamiliar environment? Is there somebody unfamiliar who came in their home? Is there noise? What happened immediately after? Could something be causing the person pain? Do they have stomach pain, headache? Could this be related to medications or illness? And you may have to consult a physician just to be sure. So explore the potential solutions. Are the person's needs being met? The client could be simply hungry, or they could be having a tummy upset. Can adapting the surroundings comfort the person? Sometimes maybe it's too noisy. There's too much stimulation. The TV is on, the radio is on, there are kids running around. It's just too much excitement. So can the surroundings be changed? How can you change your reaction and approach? And you could try different responses. And did your responses help? You can try telling them you are all right, it's all right. Did that help calm the person? Do you need to explore other potential solutions? If so, what can you do differently? So negative behavior may be related to physical pain, as we said before, maybe an illness. A common illness is a UTI for adults. Medication, did they miss their medication? Did they take too much medication? Because they forget, remember, so they can take their morning dose and take another one an hour later. Is that what could have affected them? So really, as a caregiver, you have to have your eyes open. Are they hungry? Recently, I had a patient of mine just call me, and she was a patient with dementia. And she says, oh, I don't feel good. I don't feel good. So I asked her, so did you have breakfast? And she said, oh, I didn't have breakfast. So it could be simple like that. They're just hungry. Are they thirsty? We spoke about overstimulation, loud noise, or a busy environment, unfamiliar surroundings, complicated tasks, difficult in with activities, even just a simple thing as vacuuming their home. To them, that can be very difficult and frustrating and be the trigger for this behavior. Frustrating interaction, inability to communicate effectively may cause fear, sadness, or anxiety. They are not able to let you know this is how I'm feeling, and you don't get what they're saying, and that will be a source of that frustration. So this aggressive behavior may be verbal. They will be shouting, name calling, or they're physically hitting you or scratching you, pushing you. So it's important to try and figure out what's causing this anger and try to prevent it from happening when possible. So how should you respond? So it is really going back to find out what's the cause of the pain. Are they having a headache? Try to identify the immediate cause. Think about what happened right before this behavior happened. That could be the trigger for this behavior. And focus on the feeling, not the facts. Look for the feelings behind the words or the actions. Maybe that day they are feeling sad. Maybe that day they're just feeling, how come I'm, depressed? How come I can't remember my own child's name? Something like that. And that could be the trigger. So try not to get upset with them. Be positive and reassuring. Limit distractions. Examine the patients or the person surrounding and adapt them to avoid other similar situations. Try a relaxing activity, music, a massage, Exercise will help to soothe the person, or you can shift the focus to another activity. If a situation or an activity causes the aggressive response, try something different. Say if it was cleaning and it's bringing frustration, you can try maybe let's go for a walk. You suggest something different and speak calmly and try to reassure this person and slowly in a soft tone that this person will feel heard and they'll feel safe, around you. And sometimes, of course, we realize that this aggression can get escalated, and it's you too, your emotional well-being is affected. And in such cases, you may need to walk away. As long as the person is in a safe environment, walk away and take a moment for yourself. Because remember, when you are calmer and when you are able to also calm this person. But if both of you are upset, no one will be able to calm the other. So it's okay to walk away, take a moment for yourself and go back, because taking care of patients with Alzheimer's is not an easy task. So ensure safety. Make sure, there are no knives or things that they can use to harm you or harm themselves. And seek assistance from others. Sometimes, these patients are bigger than us, are stronger than us. So you may need assistance from others. And it can also escalate to having to call 911. But remember to inform the responders that, this patient is a patient with dementia, so that they'll know how to handle them. Many of us have seen those stories on television where the 911 is called, they come in, but because they don't know that this person has dementia, the handling of that patient isn't too good, and that can even, escalate the problem even further. So people with dementia can become anxious or agitated for many reasons, and it can help to learn what triggers this response by considering the person's surroundings, the time of the day. They could simply be tired, they need a nap. Evaluating the potential sources. We spoke about pain, hunger, need for sleep, and sudden changes. So we spoke about to check for pain. Pain is a trigger for anxiety and agitation, and also to listen. I think very often people assume that this patient or this person has Alzheimer's. They probably won't remember, or they're in their own world. So they're not given the time of day. But they're also people like us. They have emotions, and they also want to be heard and want to be recognized and appreciated. So take time to listen to them. Just listening to this person, that can also be a source of a way to calm them down and to reduce that anxiety. And provide reassurance, speak in calming tones and phases. Let the individual know that you are there for them, you are there to support them. And once they feel that support, that could also cause that aggression to go away. And involve the person in activities, in art, in music, we spoke about this, and other activities that promote relaxation. Modify the environment. If there's too much noise, turn down the radio, turn down the TV. You might even need to switch it off, or move that your client to another room where there's less noise. And also find outlets for that energy. Some of them need to go for a walk. Some of them have pets, and pets can also be calming. So you can bring them around their pets, and that can also be a source of comfort or reassurance for them. A person of Alzheimer's may not recognize people, places, or things. She may forget relationships. Or call family members by other names, or be confused about where home is. So the purpose also may forget the use of simple items in the home, like forks and knives. So this can be also a source of frustration. So just for you to be aware that it doesn't have to be a complicated thing. Just a simple thing can be a trigger for this aggressive behavior. So always respond by being calm, And once you're calm, you'll be able to recognize the painful situation or something that's causing them pain. And it's also nice to communicate this to the family members. Communication is always key with Alzheimer's. And also always offer them a brief explanation. Don't make it very complex. And another way to help your client with her confusion, with their confusion, you can show them photos and things to remind them, and and this will be to remind them of the important relationships and places, and this can help them calm down. And when you're offering corrections or suggestions, do not sound as if you're scolding them, but just as if you're suggesting. So you say, I thought it was a fork. I think it's your grandson, so that they don't feel that you are attacking them, and this can make them more defensive and escalate the problem even further. So don't take it personally that they're reacting to you this way or that way, but just continue to be calm and be supportive to these patients with Alzheimer's. And also something that's frustrating to caregivers, if you're answering this question over and over and over again, and the client keeps moving, basically repetitive actions. In most cases, these clients are looking for comfort, for security, and for familiarity. These actions are rarely harmful, but can be stressful to you. So what do? So look for a reason. Try to find out if there's a specific cause or trigger for the repetitive behavior, and focus on the emotion rather than reacting to what the person is doing or how, or respond to how or she is feeling. Just find out, just focus on their emotion. And also you can turn that repetitive action into an activity. Say, for example, if they are rubbing on the table, you can, hand them a cloth and say, oh, let's clean the table. Let's, clear up and put the dishes away, so that you turn it into something positive for them. But always, as in all situations, remain calm and have a gentle voice to go with that, and provide an answer. Give the person an answer that she or he is looking for, even if you have to repeat it several times. And we know that this is taxing on a caregiver, but if you understand the disease process, then it will help you to be able to be caring and compassionate towards them. And also engage the person in an activity, kind of like to distract them. You can take them for a walk, or work on a puzzle. You can have them go feed. Some people have ducks in their neighborhood. You can do something that kind of distracts them so that they don't have to concentrate on that activity. And you can also use memory aids like notes, like pictures, like calendars, something to distract them from that repetitive activity. Another thing that these people usually can be, patients or clients can be suspicious, and don't take this thing personally, and they may misinterpret what they see or what they hear. So just be aware of that. So how do you respond if they are suspicious? Don't take offense, and don't try to argue or convince them otherwise. Just offer them a simple answer. That, oh, did you take my purse? No, I was just, cleaning up. I was just doing this. Just something simple. And you can also use the tactic of switching the focus to another activity. And sometimes they can, because all the time they're in one of the repetitive actions could be looking for their purse, and they can be suspicious that you took their purse, but meanwhile their purse is not in their car, it's probably in a bedroom, so one of the other tactics, you can ask their family members to provide multiple purses, so that the patient keeps seeing the same purse in different rooms, so that to avert the frustration and the suspicion towards you. Another symptom is that they wander and get lost, and this is very common. And 6 out of 10 individuals will wander at some point and get lost, and especially as the disease progresses. So how do you respond? Again, you engage them in some activity. This will help to discouraging the wandering behavior, to reduce the anxiety, the restlessness. But if the person shows interest in getting out of the house, consider safe outdoor activities, unaccompanied walk, gardening, playing with their pets. Inform friends and neighbors around that the person has Alzheimer's and they may be wandering, so that at least your neighborhood, your community around will give you that support in case they have wandered off, to bring them back home. And make the home safe. You can put deadbolts on the door, and to limit access and also potentially dangerous areas, especially like the kitchen. Some patients with dementias, they have trouble sleeping, and this is very common, or their sleep pattern may be altered in one way or another. And also because those the changes in their sleep are as a result of the disease's impact on their brain. So how do you respond? You make the environment comfortable, the sleeping area. You use night lights. You maintain a schedule as much as possible. You have waking time, meal times, and going to bed time. If the person has trouble sleeping at night, it may be helpful to limit the daytime naps. Exercise is a great thing, even for a regular person. All of us, exercise is great to promote restful nights. You avoid stimulants like coffee, like nicotine. And if the sleep disturbance is too much, you can also talk to their doctor that can help identify causes and possible solutions for your client. So those are the resources that we looked at to create these slides for you. Thank you very much for listening to me. And does anybody have a question? No, okay. Thank you. I'll be waiting for anybody who needs the PPD.
All right, so now you guys get to listen to me talk for the next hour or so. No, I'm just kidding, don't worry. I have 2 topics to review with you all today, and then we will, the day will be ended. We will have lunch coming shortly, so let me go ahead and move through the material so that you guys can be ready to go when it's time, when the time is up. So let me please review with you all cultural diversity in healthcare. So obviously, you know, there's certain manifestations that are different, that make us all different. That's going to include religion, ethnicity, national origin, and gender. Some things that are going to be a little less obvious, you know, to the eye is going to be individuals' age, educational status, their mobility or differently abled people, and sexual orientation. So let's, if we could please just take a moment to look at what is culture. Culture is going to include the values, beliefs, standards, language, thinking patterns, behavioral norms, communication styles, etc., shared by a group of people. So culture is going to be a guideline. It's going to be a guideline to help make decisions and actions of a group through time. And it's generally a learned and or shared thing. Obligations of healthcare workers, as it relates to culture, is to be respectful and sensitive to another's belief system, to be culturally competent and comfortable with those they serve, and to understand how their own personal biases and values are going to influence communication with patients, families, and coworkers. So let's look now at ethnicity. What does that mean and how is it different? This refers to a classification of people based on a national origin or culture. So examples of ethnicity are going to include African American, Asian American, Middle Eastern, Native American, European American. Race is going to be a little different as it relates to people based on physical or biological characteristics. It's going to include multiple cultures and ethnic groups. The term cultural sensitivity refers to being open to learning about and accepting of different cultural groups. It's going to involve multiple cultures as well as ethnic groups. Multiculturalism is the recognition and acknowledgement that society is pluralistic, meaning there's not just one type of person. In addition to the dominant culture, there's going to be many other cultures that are going to be based on the other things that we just discussed, including ethnicity, sexual orientation, geography, religion, gender, and class. So why is cultural competency important? Healthcare workers need to be aware of and sensitive to cultural diversity, life situations, and other various factors that shape a person's identity in order to provide appropriate care. The first step is to have an open, non-judgmental attitude. Cultural competency refers to the understanding of diverse attitudes, beliefs, behaviors, practices, and communication patterns attributed to a variety of factors. The healthcare provider is culturally competent when he or she is able to deliver culturally appropriate and specifically tailored care to patients with diverse values, beliefs, and behaviors. Providing culturally competent care is an advocated strategy for reducing health disparities. So let's look at areas of cultural diversity. You can look at family organization, language, personal space, you know, how some people like to greet with a hug and others you would not dare do that. Touching, gestures, healthcare beliefs. Some practices believe that if I'm sick, don't tell me. And certainly if my mother is sick, do not tell her. I don't want her to live her last days knowing she's sick. Other cultures embrace knowledge and information. Spirituality, religion, even something as simple as eye contact. 4 elements for cross-cultural communication are going to include awareness of one's own cultural values. So are you attentive to your own preconceived notions of other cultural groups? And awareness and acceptance of cultural differences. Do you yourself look for opportunities to meet and interact with individuals who are from cultures other than your own? Development of cultural knowledge. Are you familiar with the worldviews or cultural groups other than your own? And then the ability to adapt to the cultural context of the case. Do you know how to navigate cross-cultural interactions? Cultural diversity and healthcare is going to include acquiring a cultural competence in order to reduce the chance of stereotyping. Starting with awareness, it grows with knowledge. It's enhanced with specific skills and polished through cross-cultural encounters. Ask yourself these questions. Who are my patients, the families, and who are my coworkers? How can I learn about them? What are my beliefs about this particular group? And now you can acquire knowledge of the cultural values, beliefs, and practices of your customers or your clients. Ask them questions. Listen to what they're saying. Account for language issues and language barriers. And be aware of your communication styles. Being sensitive to language barriers is important, especially here in the Atlanta area. We are a huge culturally diverse area. So you need to know, does the patient understand English if you yourself are English speaking? Are they literate? Can they, if you ask them to write something down on a paper, is that something they're able to do, or can they read it? You can also consider visual aids in demonstrating procedures. Check to see if they understand what you are saying. And finally, do you need an interpreter to be able to provide the services where needed? You want to consider religious and spiritual factors, including sensitivities or beliefs associated with birth and death, certain treatments, different blood products, prayer, meditation, and worship, as well as food preparation, clothing, special objects, and gender practices. Ways for you to facilitate communication across cultural boundaries is going to include recognizing differences, not evaluating or judging the individual, building your own self-awareness, describing and identifying and then interpreting the case for your own. Do not assume that your interpretation is correct. You can verbalize your own nonverbal signs. Share your experience honestly. You can acknowledge discomfort, hesitation, or concern. It's always best, especially when dealing with a patient and caregiver relationship, to practice politically correct communication and be patient and attentive when communicating. You also would want to consider body language. This is going to include eye contact, touching, personal space, and the need for privacy or modesty. You see this a lot when delivering personal care to individuals. It is something that oftentimes can be difficult if you're not of the same culture. You want to also consider things like factors including gender, wealth, or social status within the culture, presence of a disability, as well as sexual orientation. A very important notion to keep in mind when delivering care, it is because we are different that each of us is special. Every single person in this room, every single client that we serve is unique and special. And we want everybody to be treated follow the golden rule, treat others as you wish to be treated. Everyone wants dignity and respect. And that is the most important thing when dealing with and working with people of different cultures. And like I said, MedSide is probably one of the most culturally diverse. You can just look around the room here today. We have people here from probably about 10 different countries, speaking many different languages and practicing many different beliefs and customs. And it really makes us unique, and it's very awesome to be a part of it. So thank you very much. That is the presentation on cultural diversity. Our final presentation today is regarding nutrition and meal preparation for home care clients, which I think is good timing because hopefully lunch is going to be here in about 10 minutes. So I'm getting a little bit nervous. So hopefully it'll be here soon. So let's go ahead and talk about nutrition and meal preparation for the home care clients. One of your most important jobs as a home care worker is going to be preparing food for your clients. There's a lot to know about it. And even though much of it is information which we should already be aware, the reality is that a lot of people tend not to know. As most of you know, food is important. I would guess that in this room here, probably 90% of us think food is important in our daily life. People like food. It means sharing. It means celebration. It means nourishment. So food is something that is quite important to us as people. Your clients are not, unique in that it is definitely going to be important to them. Let's look at some of the basics of nutrition and what you want to keep in mind when preparing food for your clients. There's a USDA food pyramid, okay? So what this means is a pyramid, of course, is a triangle. At the bottom of the pyramid, or the most per day, that's generally recommended, is going to be carbohydrates. This is going to include foods such as whole fruits and grains, things like breads, pastas, things like that, starchy vegetables, potatoes, sweet potatoes, even some like peas, certain green vegetables like that. And it should generally make up the bulk of the diet for most of our patient population. Now, the amount is going to depend on any kind of dietary needs that they have. So that's important to look at. For example, you may have a patient or client that has diabetes. In that case, blood sugar is monitored very closely, and typically carbohydrates are going to be limited. So it is something that you do have to take into account the individual's special diets or dietary restrictions. We'll talk more about that in just a minute. The next building block of good, nutritive food and how you want to eat is going to be made up of protein. This is going to be including some like animal flesh, such as meat, fish, poultry, as well as certain kinds of vegetables. Also, certain dairy products like cheese and eggs are typically higher in protein. Protein is extremely important for our patient population because it does help with the preservation of muscles. And it is something that's extremely important, especially for people that are going to be less active, because if their skin were to break down, you may see what's called bed sores, if you're familiar with that term. And a lot of times this can be helped significantly to prevent bed sores if the person has an adequate supply of protein in their day, because it does help with their skin as well as their muscular health. Fat is the third building block, and all fat is not necessarily bad, especially again for our patient population. It does help them with not only, protecting certain, your organs and things like that, but it's also going to be helping them reduction of those sores if they have a little bit more fat with them, but regulating temperature, etc., things like that. Certain non-nutritive food items that your patients are still going to need are going to include things like water. Water is very important to people. It doesn't have any calories, so it doesn't add any nutritional value, but it does have hydration, which is extremely important, especially as here in Georgia, we get on with the summer months. We all know it gets very hot. And we all know that most of our clients like it to be very warm in their homes and apartments. And so hydration is extremely important to maintain for your patients throughout these summer months, but really all year round. There's also vitamins and minerals. This is going to include things like calcium, zinc, vitamin A, vitamin B. A lot of people now have vitamin D deficiencies, and et cetera. So they may have to take supplements to assist them. Some spices may even serve an important function as it relates to making food. And that not only, as we just talked about, cultural diversity, throughout cultures, people use typically different spices in their cooking. But a lot of times as people age and get older, they lose their sense of taste, okay? So spices are going to be important to help food taste better. People's taste does change throughout the years, and so they might somebody might be eating something and think, I always liked, hamburgers, but now I just don't care for them because they don't taste like anything. Well, if they put some spice on it, they enjoy it more. Things like that. So it is an important factor when preparing food. Variety is very important to most people. You are going to talk to your client. You're going to ask, what do they like to eat? If a lot of the clients that we serve get Meals on Wheels or the already prepared meal, so all you're going to be doing is helping serve it to them or warming it up, something like that. Some of them are fresh, others are frozen. However, if you have the opportunity to assist them, it's important to keep some variety of foods in the diet and to base it generally on the food pyramid or the different things that are going to be important for them to consume. This is an example of a plate that you can look at when you're preparing a plate, and you can use this for your own information as well. It's not just for clients. When you're looking at your plate, what should it look like? So they have it sectioned off, and you can see vegetables and grains are going to take up more than half of your plate. Proteins and fruits, and the reason why fruits is smaller than vegetables because fruits have more sugar in them, or they break down into sugar. However, it's not unhealthy. Okay, so don't limit your fruits, I would say. But grains and vegetables should take up the majority of your plate. And then protein and fruits to be a little bit less. So let's look at the USDA Guide to Healthy Eating. And this is, again, I want to specify, these are general guidelines that cannot be applied to every patient or client or to all of you individually across the board. You always need to take into account your own health situation, if you have any dietary restrictions or any need for special diet. So generally speaking, you should balance your calories. As Americans, we generally enjoy an abundance of food at all times. But however, you should definitely enjoy the food, but eat less of it overall. Avoid oversized portions of food and use exercise to offset your intake. So if you're going to consume a giant plate of pasta, you probably need to get out on the treadmill for a little bit that day just to kind of make up for it, or that piece of chocolate cake or the cookies or what have you. Foods that you should increase are going to include fruits, of course, and vegetables to make half of your plate up consisting of fruits and vegetables. You can also make at least half of your grains that you consume whole grains. So when I talk about pasta, generally you want to look at the non-bleached or the whole grain pasta, whole grain rice, things like that. Consider drinking either fat-free or skim milk or 1% milk, because this is going to lessen the fat intake of milk or dairy products. Certain foods you're going to reduce, and that's going to be things that are high in sodium, like soup, certain breads, and frozen meals. This is really important, especially as we look at our patient population. I went to the grocery store on Saturday, and I almost fainted at the amount that I spent at the grocery store because food is expensive right now. This is a factor in people eating healthy. It's a lot cheaper to buy a can of corn than it is to buy corn on the cob, okay? And that's the reality of it. However, you want to look at that can of corn and you want to see the sodium content. Sodium basically is salt. It's the preservative, okay? It is extremely important to maintain lower sodium foods, especially in our patient population, as most of them do need to be on a more heart-healthy diet. Things like canned soups, or the condensed canned soups, ramen noodles. Ramen noodles are extremely high in sodium. Things like canned vegetables. Anything in a can, it's in a can because it's preserved. Okay. And so this is something that you really want to make sure that you are monitoring the sodium intake in that before just dumping it on everything. And of course, to substitute water for sugary drinks whenever possible. Certain challenges that you and of course your clients are going to face to healthy eating are going to include special diets or dietary restrictions. That could be things like no dairy or no gluten. People that want to eat an organic, vegetarian, or vegan diet. Low carb, that's a very popular diet that people eat. Cost issues that we just discussed. Like I said, it's a lot less expensive to buy a can of corn than it is to buy several ears of corn. But it is really important to try and get the fresh fruits and vegetables whenever possible. And then, of course, you have certain personal taste. You're going to have, some people just don't like spicy food. Other people don't really care a whole lot for different varieties of food. They like the same thing. They want to eat it every single day. I'll tell you, my dad has a bowl of cereal, same cereal, every single morning at about 6:30 in the morning. And if he doesn't have that, he's not happy. So, you do have some people that just want regular things all the time at the same time. So you as a PSA, a personal support aide, can help because a lot of times you're going to be doing the grocery shopping for your client. They're going to give you a list of things, or you and your client are going to develop a list of items that they want, but then you're going to go to the store. When you're at the store, it's important just to be mindful of what is being spent. Be mindful of different brands if something's on sale, unless they're brand specific. You want to be mindful of things that might be on sale. And even if they don't specifically request it, you might want to throw in a fresh fruit or vegetable every once in a while and prepare it for them. Some of your clients are at the point where they actually need assistance with feeding themselves. When feeding somebody, please be respectful and treat that individual with dignity. That's that could be something that weighs on them very heavily because it can be seen as almost childlike. And it could also be a reason why somebody does not want to eat because they don't want the embarrassment of having to be fed. It's very important that you assist them in a dignified and respectful manner. Preparing food is going to be very important, and including in that is, of course, washing vegetables properly. It's also going to include cutting things appropriately. Your client might need things cut smaller or to have food prepared a little bit softer, so that they can eat it better. Again, try to avoid frying or convenience foods. Find out how the client likes food prepared and try and use whole foods and grains whenever possible. Please be mindful of what your client is eating. I mentioned at the beginning, food is generally very important to individuals. If your client has a sudden change in their eating habit, some people just don't eat a lot, and that's fine. But if your client all of a sudden is not hungry, try and get more information from them. Also report it to the nursing supervisor. There's a lot of reasons for that. Certain medications people take can affect appetite, either increase it or decrease it. A very common problem why people stop eating is ill-fitting dentures. And if you've ever tried to eat with dentures that don't fit, it's nearly impossible. Or if they just take their dentures out altogether. And so then that's going to make it difficult to eat certain foods as well. So just be mindful of it. Try and get more information and just try so that we can help to resolve whatever the issue is. Best practices, of course, for food storage, store foods that need to be refrigerated in the refrigerator. Generally put meat products towards the bottom shelves so that to avoid the cross-contamination. Fresh fruits and vegetables don't always have to be stored in the fridge unless they are ripe or overly ripe. And as I mentioned earlier, be sensitive to pricing and use of coupons when you're doing the shopping for the client to try and maximize their budget as much as possible. Does anybody have any questions or anything they would like to share regarding nutrition? Yes, yes. And that's actually a good point. A lot of times people face, can I get some suggestions on meals to present? The internet is a plethora of information for you. But there's also different sites where people post specific recipes. You could probably search on Pinterest, asking about recipes for elderly people or something like that. So it is something that you really want to investigate if your patient doesn't really like food or doesn't like what you're preparing, but have that conversation with them as well and ask them what is it that they would like. All right. On that note, you all are probably hungry. So if you would like, that's going to conclude the training for today. If I did not pick up your test and health screen form, please make sure you drop it off when you leave. Crystal and Alexis, say hi to Alexis when you leave because she's our new call center representative and you all know Crystal. So they're going to help serve you this afternoon. And we wish you all a fantastic summer and thank you all very much.